Welcome, everyone, and thank you for being here with Amazing Kids, where we believe people with autism are truly amazing. Please mute your microphones, keep cameras off, and use the chat to share reflections or questions as we go. We'll open live Q&A near the end of today's conversation, and you are also welcome to email questions afterward at amazingkidsautism@gmail.com. Today is part of our parent conversation series, Real Stories, Real Perspective, and Practical Encouragement for Families Navigating Autism. Let's begin. Welcome to the Autism Playbook Seminar. I'm Simone Olson, co-founder of Amazing Kids. This seminar exists to give parents clarity, confidence, and practical guidance so they can lead their child's care team with hope. My co-founder, Dr. Jennifer Hensley, a pediatric nurse practitioner with more than 20 years of experience supporting children with autism and leading multidisciplinary diagnostic teams, both in traditional systems and through evidence-based virtual models, will guide our conversation today with our guests, Fred and Lindsay, who have generously agreed to share their journey from early concerns to diagnosis, therapies, growth, and perspective. Fred is a captain in the U.S. Navy and a practicing oral surgeon. He also started off school with graduating from Virginia Tech in 2002. Go Hokies! Lindsay is also a fellow Hokie and graduated from Virginia Tech in 2002. And they are both here today in one of their most important role as Dominic's parents. Dominic was also planning to join us this morning, but he is not feeling well. We hope he feels better soon. In this conversation, we will talk about the early signs that led them to start asking questions, what the diagnostic journey looked like for their family, and the practical steps that helped their son Dominic grow and develop over time. If you are a parent early in this journey, this conversation is meant to give you encouragement and perspective. Welcome, Fred and Lindsay. Thank you for spending time with us today. Dr. Hensley, I'll hand it over to you and you can get our conversation started.
Thank you, Simone. Good morning, everybody. If you've joined us, please put your name in the chat and let us know what brings you here today. And also, we're going to be having a 15-minute question and answer session when we're finished. So you'll have the opportunity to ask both Fred and Lindsay and myself any questions. So I'm Dr. Hensley, founder of Amazing Kids Autism, where our mission is to break down barriers to autism diagnostics and autism care and reduce the wait list from 1 to 2 years down to just 72 hours for an in-home comprehensive medical evaluation. People with autism are amazing, and we're here to shout this from the rooftops as we're going to get to know Fred and Lindsay and their amazing son, Dominic. No limitations, no restrictions, and no telling anyone with autism that they can't do something just because of their diagnosis. So our goal is to help you understand today what a good diagnosis actually does for a child and a family through this amazing testimony. Don't be afraid. You're not alone. Autism doesn't mean the end of possibility. It's truly the beginning of momentum. Autism isn't something that just happens. It's the way a person experiences the world. And when we understand that, everything changes how you're going to see today with Dominic. His world is opened wide up because of these amazing parents and advocates that he has. So good morning, Fred and Lindsay. How are you today?
Good morning. Good morning, Dr. Hensley. We're doing well. Thank you for having us. How are you?
Doing fabulous. It's so good to see you both. And so today we're going to just jump right in and ask questions. And I know you guys probably have a lot that you want to share with other families. So I just kind of want to start off with in the beginning, like what were those early moments that you realized that your amazing son might be a little different? I think your journey is going to be fabulous for people to hear because of his gifts and talents. But what were some of those early moments like before a diagnosis?
So reflecting back now that I know about his diagnosis, I can kind of see things more clearly. Being a first-time parent, I didn't really have a baseline to go off of. And now that I think back to moments as Dominic was growing, things that I thought were cute or different or maybe a little frustrating, I now understand were actually early signs of his autism. When he was young, I have thought it was adorable how he would use my hand as an object to grab things for him. I thought that was cute. He would lead me around by the hand and put my hand on something that he wanted. I just thought that was something cute. Now I realize that was actually an early sign. And then, he would kind of look at you, but not look at you quite as much. And, I just thought it was just him just being cute or shy or something. But now I understand what that meant. And his toe walking when he was a baby, he would walk around in his tiptoes a lot. And I thought that was just something cute that he would do. And now I realize that was actually a sign. So I think from the very beginning, it's always been there. He was born with it. But the things that I didn't know to look for, now I can clearly see were signs. Even as like an infant, he always kind of appeared to be. I would say to some of my friends, like, this feels so much harder than what I see. Like other parents seem to be like okay with this, and he was very sensitive to lights and sounds and noises and digestion, and I thought it was normal that he'd like wake up like every 60 minutes, and constantly be like fussing for something, right? Now I kind of realized it was probably because he was taking in more of the world around him than maybe a neurotypical child would. And so those moments that felt so hard were actually a lot harder because of that. And I just didn't know to look for that. And then, as he grew and progressed and had some late verbal development, that's what then really started to catch our attention was, hey, he's not really talking. And my father was one of the first who said to me one time when I was visiting them in Arizona, I don't think Dominic knows his name. Because when you'd say his name, he wouldn't turn and look, and having raised a neurotypical child, he was like, by his age, if I said Lindsay, you would automatically look at me. But you could say his name many times and he wouldn't turn around and look like he didn't recognize it, So I think there were definitely a lot of early signs there that now looking back, we can definitively say why those signs were there.
Anything additional you want to add, Fred?
I saw a question flash in the chat how old Dominic is. Dominic is 8, and he'll be 9 right before school starts for third grade. I think that what I probably noticed the most was some of his what I now know are Sims and repetitive habits. The two most noticeable ones would be turning the lights on and off,
And the toy.
basically nonstop. 50 times in a minute. And then, this was at the beginning of COVID. So there were, if everyone remembers, hand sanitizer dispensers every 20 feet, no matter where you went. And there was one in Dr. Hensley's evaluation room. And the first time I brought him to meet Dr. Hensley, I think that he consumed probably half of the liter of Lysol or Purell, whatever was in that container in that 50-minute appointment. And so, that I would scratch my head a little bit with those behaviors. Now, obviously, I understand more conceptually, but at the age of 8 now versus back then, he would have been just shy of his 3rd birthday. Mm-hmm. I think right around that time, he does not do those behaviors. He taking aside the fact that he's getting over the flu right now, he would be right now playing Mario Brothers or Roadblocks, and at the level of a much older kid. And I'll get into that further in our discussion, but he has some unique didactic skills, we'll say, that the schools have already kind of talked to us about.
Yeah. And the lining up of the toys, they always like have that meme of the autistic kid lining up the toys. Dominic definitely was one that would line up toys too. And again, I just thought that was a cute little quirk of his, and now I realize what it was. And watching the wheels spin on the cars, he would pick up the car and just spin the wheel and look at it really close up. That was another thing that he would do. Yeah.
Can you also share how articulate Dominic was at that time and what his verbal ability was?
He did not have a lot of verbal ability, I would say, until he got closer to the age of 4. He started getting verbal ability. We got him into speech therapy right away. And I would say that he did not really start to show more robust verbal ability till 4. 5 was when he really got into speaking the full sentences. And now he's completely verbal, completely clear, outside of some stuttering that he does still have. He is completely verbal and completely clear in his speaking. But it did take a while, and speech therapy definitely is absolutely needed, just because not only does it help with them learning to process the verbal ability, but also talking about their emotions, processing emotions, finding the right type of speech therapist who will work on not only, can I say the words, but do I understand what the words mean as well? We were blessed to have a wonderful speech therapist who's been working with Dominic since he was 3 years old. And she's amazing because she not only gets him to think and speak, but, what do I feel? How do I feel it? What do other people feel? How do they feel it? How do I verbalize those emotions? How do I process those emotions? A lot of times now when she comes, she'll sit and talk with him about, stuff that happened at school, maybe challenges that he's been having with some of his friends. He has friends at school who have, either ADHD or autism as well. And so, them trying to process each other's emotions and talk about each other's emotions and, well, how can we talk to Asher and explain to him when he does something, how that makes me feel? She'll work with him on things like that as well, in addition to just saying the words. But what do the words really mean?
So you both have been tremendous advocates for Dominic from probably the minute he was born, but definitely from the minute I first saw you. You absolutely knew how to advocate for him, even though this was a whole new world for you guys. Can we kind of just take a step back and talk about the diagnostic process and the emotions that kind of came along with that, waiting for the evaluation, how the evaluation was for you guys, and then what that diagnosis unopened, what kind of doors it opened for him?
Yeah, so we kind of had an unusual journey getting to the diagnostic process, because when Dominic was first born, he had a little bit of torticollis, and the torticollis was treated with some PT. And it was the PT who first noticed that he wasn't meeting some of his developmental milestones as well. And that's when she brought in speech and OT to do some evaluations. And in one of the evaluations, it noted that Dominic was at medium risk for being autistic. And, because he wasn't doing pointing, he wasn't making the eye contact, he wasn't doing a lot of the things that one would expect somebody of his age to be doing. And so that kind of led us like, oh, maybe these things that we think are quirks are actually something else. Getting in to have the diagnoses was challenging because COVID happened. It was around the time of COVID that we really started getting all of the diagnostics going. So that was challenging. Finding somebody who could do the appropriate diagnosis was challenging. Dr. Hensley was like the only developmental pediatrician as I learned, basically in all of Northern Virginia, like not just in the military system, but in Northern Virginia in general. Like the only other place you could go, would be into Fairfax, Inova, and they have a massive 3-year waiting list, right? And so we were lucky enough to get in with Dr. Hensley, who, upon meeting Dominic, said, well, he has autism. And, I was shocked. I didn't understand or know what that really meant initially, because, I'm like, well, no, that can't possibly be, he's fine. He's just got some quirks, right? Well, now I understand, that it was autism or is autism. But having that diagnosis allowed us to start implementing the early interventions. And that is what has been the biggest key in Dominic progressing the way he has, was from the moment that we accepted the diagnosis, because initially I was reluctant to accept, but once I accepted it and decided to move forward with it, we were able to get ABA, right? We were able to add services that we couldn't do before. And Dominic, when he started ABA, did intensive ABA. He was doing 30 something hours a week of ABA. They would go to his preschool, he would go to their center for an entire day. And I think that actually, initially had some of the biggest impact, because they worked very intensively one-on-one with him, and then also in the group settings at one of his daycare centers, to really hone in on a lot of skills. And it wasn't just social skills, but it was practicing writing, toileting, things that, would be challenging for us. Hair washing. They would come to the house 2 nights a week. He would go to their center for a full day, a couple days a week. They would go to his preschool for multiple hours each day. And so, they helped us immensely with all sorts of things we were having problems with. Because of them, we were able to wash his hair now. Initially he'd be hysterical during hair washing. Now he'll wash it himself. And Mr. Gio, our first ABA therapist, one of the most amazing people I've ever met. He worked so intensively with Dominic to teach him this is how we wash our hands, this is how we use the bathroom, this is how we wash our hair. He was a blessing in our lives. And when he moved on, we were obviously sorry to see him go, and then we were lucky enough to have other wonderful therapists who worked with him throughout the years. But I would say initially, because were able to get that diagnosis with him so young, and doing that intensive ABA right up front, that I believe had the strongest impact in his development.
I mean, and of course we can diagnose at any age, but ideally we really want to get these kiddos diagnosed in that 2 to 3 year zone, so that really can open the door to the services, which you definitely have mentioned. I kind of want to dissect a little bit more something that you had mentioned, the reluctance for the diagnosis.
Yeah.
It's the grieving process is real. Parents have to go through. And that reluctance, can you just dig a little bit deeper into that? And then how did you get yourself to the point of, okay, we can do this. Let's move forward.
Yeah, and I'll let Fred speak for his own self there on that part. But for me, the initial reluctance is kind of that idea of like, well, this could possibly be happening to my child, right? Like he's perfectly fine. He doesn't seem like he has that many problems, right? And then, also the stigma a lot of times the society places on people who have neurodevelopmental issues, that whole idea of I don't want his identity to be the kid with autism, right? So there was that. I did not want to label him because I know society does not treat people kindly once they're labeled a lot of times. But I also did not want him to be denied the services that he needed in order to progress. And that, if I don't give him this diagnosis, then I can't help him, right? Because things like ABA are not available unless you have, well, you can pay out of pocket, but I'll tell you it's insanely expensive. So if you don't have the diagnoses in place, you can't get those services, right? And so I've eventually said, me accepting it or not accepting it isn't going to change it, right? He's going to be what he's going to be. And the best thing I can do for him is get him all the services that he can to try to make him, into the most functional version of himself that he could possibly be, right? By getting him as many services as I can. And to this day, I still fight for all of his services. I think ABA has been the biggest challenge because it's hard to get them in. It's hard to find the right providers. He does not do ABA anymore, and not necessarily because he fully graduated. The company we were using no longer, they started transitioning to working with teenagers. And so they discharged their younger children. And I was never able to find another company to pick him up. But he was down to only doing 3 to 4 hours a week. And his BCBA kind of said, yeah, there are still some things that ABA could work on with him. But if you don't move into more ABA and just continue with OT and speech, he'll probably be fine. He doesn't really need the intensive ABA anymore. So, he no longer does ABA. But having that diagnosis early on when he was able to do the intensive ABA before they go into school, that is really where you see the biggest bang for your buck, because the after school hour ABA is very hard to get into, very hard to find. And even then, they still want you to do 12 to 15 hours a week, 20 hours a week. And at some point, they reach a point where they don't need that many hours. They don't have time for that many hours. And you don't want it to become their entire identity and their entire life. You want them to do other activities that they enjoy, And so we made the decision that Dominic was doing well enough that, we could work with Miss Cindy, his speech therapist, Miss Amy, his OT, and he can still do his other things he likes, his swimming class, his taekwondo class. He does piano and vocal class too. So we wanted him to be able to do those things that he enjoys in addition to his therapies. So his identity is not just somebody who only goes to therapies after school.
I love it. I think you, again, you guys have advocated from the start, and that's the goal, is to graduate from therapy and to just be a kid, right? And he's already doing that at such a young age. Fred, can we kind of step back for you, and what was your feeling with that initial diagnosis?
Before meeting you, I felt that he was developmentally delayed in a few areas. But, I did not think that he had autism until the conversation with you, and then I had to do some soul searching within the DSM-5 because I wanted to understand it after that initial meeting. And then obviously, when we came to grips, so to speak, with his diagnosis, and I'm learning more about how it's diagnosed and how it's classified, because that changed from when I went to school until 2020. And we I've seen more and more with how he's responded to services that kind of where Dominic is. I second all of my wife's sentiments as far as the services. I remember vividly the first time that Mr. Gio came to our home. And that day, I want to say that day was his last, and we're talking late 2020 was his last, like, really significant meltdown that went on for longer than 30 minutes. Every kid, right? You have to remember age appropriate behavior, which applies to adults. It is age appropriate for a 5-year-old. If you take away SpongeBob and they're in the middle of watching SpongeBob, they're not going to be happy to you. And it could be the most neurotypical 5-year-old with no diagnosis of anything, that it was an undesired thing that you did, and you will elicit a response from that. And that's normal behavior. I think Dr. Hensley would probably concur with that. But to have it go on for 30, 40, 50 minutes, that's where it sort of goes beyond the bounds of what's considered typical age appropriate behavior. And to my memory, that was the last, one that we really had. But to watch how Mr. Gio handled it, because obviously I'm there and I am seeing everything that's happening. He never injured Dominic. He never yelled, never lost his composure, his demeanor. Essentially, if you think of, what a negotiator would do, like if somebody's, trying to rob a bank or whatnot, and you watch how a negotiator, I guess in a textbook, should kind of behave in that situation. That was really what Mr. Gio was. He just kind of waited him out. And, without belaboring, that's really what he did. And at the end, he was so exhausted from the going on the ground and kicking and, yelling, that, when you do those things as an adult, like, I can't imagine yelling and kicking around and writhing on the floor for 40 minutes. I'll be exhausted too.
Right.
And then after he calmed down, then that's where some of the reinforcement and kind of teaching, if you will, occurs. And I tried to pay attention. Lindsay tried to pay attention to what, we highlight Mr. Gio because he really, truly was, is a tremendous clinician. But I've tried to pick up what I see these professionals do, because I know they're not going to be in my house 24/7. And if I can kind of pick up little things that they do that can help me be a better parent, to me, I think that's a win-win for all parties involved. And it is, I want to say that at the beginning, 30 to 35 hours a week is about where we were. When you start doing the math, right, it's a time commitment. I had to restructure my practice, how I saw patients. It was in the middle of COVID. So, the state of Virginia and other entities were very much discouraging a lot of elective surgery. Pretty much all elective surgery went away. So, a lot of the stuff that I was doing at that period of time was the middle of the night stuff, the trauma, infections. But I had to tweak kind of how my professional life was, because we had to make sure that Dominic got to where he needed to be. The speech is invaluable. It truly, even in the realm of neurotypical professionals, just, to everyone in the audience, at some point, regardless of what you do, you interviewed for something. You did a master's degree, you did some sort of other professional education, even college. After you got out of college, you get that first job, you had to interview for it, right? And so how you communicate in the professional setting is critical. You can't put a value on that. And if it doesn't go well for you, no matter how qualified you are, you may not get that opportunity. And so that's why I won't take words out of my wife's mouth, but that's why I will go out of my way to make sure that he makes those sessions, because I know what that's going to mean in 10 years, 15 years for him, that he can articulate succinctly well.
Yeah. I think to piggyback off Fred just a little bit, because it kind of brought up a couple things that I think folks would be, interested in hearing about, since both Fred and I do work full time. One of the biggest things when this journey started for me was, how am I going to make this work? Because I have to go to work. Fred has to go to work. We both work out of the home. We don't have any work from home capabilities. And one of the things that, especially when looking at the really intensive based all day programs that are designed to have the children there all day with the professionals, is what can really work for working parents, because then it allows you to do your job as well and know that they're getting that intensive ABA during that time period. So we did a combination because we really liked Dominic's preschool he was at. He went to a Spanish immersion preschool. So we were able to do a combination of things. We did a combination where he would go to their center all day, 2 times a week. And then they would go to his preschool during the day for the other 3 days a week. And then they would also then come to the house 2 nights a week. So, you're like, oh, wow, that's so much. That's how we were able to get to that 30 to 35 hours a week, was by doing a combination of things that still allowed me to be able to go to work, Fred be able to go to work, him get all the therapy that he needed, but still then also do things that would be more of what a neurotypical child would do. So, he was able to still get some, preschool experience with other children, get the intensive ABA center-based experiences. And then we were able to get the parent training at home by having them at the house a couple nights a week. And then there was a monthly parent training that we had to go to as well, which was in the evening, and we would do that once a month. So that combination really worked well for us, because I know it's really daunting in the beginning when you're like, how am I going to fit all of this into our schedule? How am I going to make this work? And finding a program that's flexible, that will allow you to do center-based plus home-based, and in the binds of whatever your insurance allows, daycare center based. So, a lot of ABA won't let them go into schools, but they can go into daycare centers and after school programs. And that terminology is key, figuring out how to work within the confines of the insurance to get things that are still allowed. And that can be one of the biggest challenges with something like ABA, is figuring out, what will my insurance company allow? What will they pay for? And once you figure that out, working within those bounds, and then finding a way that works for your schedule. The other thing that I was very big on was finding providers that would come to my home, that made it easier for us to have it work with our schedules. So like his speech and his OT, they come to our house. And if I want them to go to the daycare center, they'll go to his after school. He goes to kindercare for after school. So they'll go to his after school center if I need them to. For some reason, I can't be at the house. But with having to drive places and living in the DC region with lots of traffic, for me, I attempted to try to go to some of the other places for speech and OT, and that just wasn't working, because, it just was taking too long trying to sit there and go there. So when you can find people that come to your house while they're working with the child, that gives you the opportunity to, do whatever it is you need to do at home. So then things aren't just piling up at the house, because it can be very overwhelming trying to get all these therapies lined up. So finding ways to make it easier on your schedule is key. We worked with TRICARE to figure out how to get our providers in their system. So then, we pay them directly. TRICARE reimburses us. It's more legwork on my part, but the benefit is every week I'm not trying to go down Route 7, for 25 minutes to some place and then sitting there for an hour and then driving back. And next thing you know, speech therapy has taken my entire night. Right. Whereas Cindy comes to the house, I'm feeding the cats, I'm doing laundry, I'm doing whatever I need to do, and she's working with Dominic. So I know as a working parent, trying to get all these therapies lined up is really daunting. So that's just some of the tips that made it easier for me, just to get all these things to work for our schedule.
I will say you guys are a phenomenal team. I mean, hands down, you complement each other well. It's a lot of work and a lot of effort. And with the diagnosis, you guys were very clear. That opened up a lot of doors. So prior to his diagnosis, Dominic had speech and he had OT and he had PT. And then the diagnosis came and you guys had a hard time just wrapping your arms around it. And then all of a sudden you realized, okay, let's do this, right? And so you got through that gray zone of unknown and into the world of known, and the light opened up, and Dominic got into ABA, intensive ABA, and did that for years. And I remember too, Dominic was also in Montessori, right? At that
Yep.
time, you were thinking outside of the box as to how can you educate your amazing child who's got so many gifts and so many talents, but the looming fear of the meltdowns and the stress and the overload that comes with autism, how do we help him grow and develop into all that he wants to be in this world and not let this diagnosis limit him? And so, our big mission with Amazing Kids, of course, we want to get these kids in and get them diagnosed. But my whole mission has always been is to empower parents with teamwork, and to see the way you guys have built a team and adjusted the team. Can you talk a little bit about what it's like to put somebody on the bench? Like maybe you had the best therapist on first base, and then all of a sudden you realize for some reason it's not working for him. And all of these people that you hire to work with him are all kind of your employees, and but they also sort of become your family. And I think that makes it hard when you look at him and say, okay, Dominic's time is valuable and he's not getting the bang for his buck for this time. And so, how do we shift our team? And whether it's school or therapy, can you share an experience of when you kind of had to fire somebody and put him on the bench so you could put a more valuable player on his field in the right position?
So I wouldn't say that we actually have ever fired anybody, but making the decision to kind of stop, like I was heavily trying to pursue additional ABA, making the decision that maybe we just need to stop doing ABA. How productive was it for us? It was kind of made for me in the sense of, I couldn't find a new provider. I could have kept pushing for it, but I kind of came to my own conclusion as I was trying to think of what benefit is Dominic getting from it at this point. Do I want to keep pushing for it? Because the only way to get him into it would have required me taking him out of school for early for many hours. And I didn't want him to miss that time at school because all the providers that were out there were saying, oh, well, bring him to our center at 1 o'clock in the afternoon. I'm like, he's in second grade. I can't bring him to your center at 1 o'clock in the afternoon. The biggest thing I was willing to do, and we were blessed that our kinder care is right across the street from his elementary school, was they were great partners with us in this. And they would walk over there at 3, which is only about 30 minutes before he would get out, bring him over to the center, to their center, and then he would do his services from like 3:15 to 5:15, right? That is as far as I was willing to go with him missing any of the school day, right? So I had to start thinking, what benefit is Dominic getting from these services? I don't want him missing any of his school day. Is this really worth the push anymore? Is he really getting enough benefit out of this anymore to have him miss school, to continue to stress me out with contacting? I probably contacted 30 ABA companies. I'm still on like 10 different wait lists. Every once in a while, they'll email me and be like, do you want to be on it? I'm like, yeah, sure, just leave me on the wait list. I don't know if something comes available, maybe we'll reconsider. But coming to that, determination that maybe ABA was no longer something that he needed to be investing his time in, that it was better for him to be investing his time in playing with the other children at KinderCare, because he, as the ABA therapist said, the last thing he really needed to work on was just some more social skills. Well, letting him socialize then might be just what he needed. Letting him just be him and play with the other children is probably better for him than being sequestered away trying to do some ABA type stuff, right? And they would go out with him in the main part of the daycare center and kind of help him work through social situations. But coming to terms with, because we've done ABA for so long, that maybe he doesn't need this anymore was a little bit hard, because it was such a big part of his life for so long, and I attribute a lot of his progress to it. So kind of stopping it initially made me be like, oh, is he going to stall? Is he going to start to regress a little bit? And I have not seen that yet, and he's doing great. Recently, I made the choice that, because Dominic is so bright and so intelligent, that it was better for me to focus on his school and schoolwork. And so one of the ABA companies that was not able to take Dominic on board recommended a service called Autism Envisioned, which is more of a tutoring service. It's meant to help kids who have ADHD, autism, other neurodivergent conditions. It's meant to help them basically work on their schoolwork. And so for me, with Dominic, what I thought would be most beneficial for him would be working more on his executive functioning skills with how do I do my schoolwork? How do I manage my schoolwork? How do I, organize my homework? How do I, as he starts going into the higher grade levels, I think that's going to be where he sees more of his challenges is having to figure out how do I manage schoolwork, right? And so we haven't fully started the process. We just did an evaluation for it the other day, but I'm hoping that will be something that is more valuable to him than maybe necessarily ABA would be, because that's where he's going at this point. They've evaluated him for advanced placement classes at his school, and so to help him be as successful as he can in those advanced placement classes, he'll need to work on those types of skills. And so I think that this company will actually be kind of our, I wouldn't say replacement for ABA, but the next step in his journey is now figuring out how do I function on my own? How do I learn how to, manage my schoolwork, look through my problems and organize it. And so I think that this company will be our next step for moving him forward.
I love how you just continue to adjust the team. And when you figure he needs that additional support, you're capitalizing on whatever resources that you can find. Tell us about Dominic now. So he's 8. Tell us the amazing things that he's doing that maybe you never thought in a million years, a couple years ago, that he would be doing.
I wanted to highlight one thing real quick. We were very blessed with Dominic. I think the 2 providers in particular, excluding yourself, because you would fall into this category as well, Dr. Hensley. We were very blessed with Dominic that we had some phenomenal, and it was, a lot of it was luck, but phenomenal continuity of care. My wife alluded earlier, our speech therapist, who's outstanding. She's the most talented speech therapist that I've seen in, 17 years of clinical practice now, where I interact with speech therapists frequently. And she met him when he was
right after when we first got here, in
3,
2019, yeah.
3 maybe.
Mm-hmm.
He's 8 now. Our occupational therapist would have met him right around the same time. We found them in a program which you could probably articulate a lot more clearly than I could, Dr. Hensley, the infant toddler program. And, just like many clinicians, they worked for the county, but they had their own private practices. And so we had conversations about that, and that's kind of how that relationship developed. But they've been seeing him since he was 3. He's 8 now. My son met you, Dr. Hensley, around the same time, and he saw you for years and years and years. And so I think that there's a lot to be said about continuity of care, if it's possible. Now, in cases where the relationship isn't working between the provider and the child, then as you put it, you've got to put somebody on the bench and you got to bring another player in. But we were very blessed that we were able to have some continuity of care. And I think that a reason why he's blossomed is due to that.
And a lot of insurance companies, like if the person is not in network, a lot of insurance companies will have provisions where you can do like a continuity of care referral. And that's how I'm able to keep Cindy and Amy on staff, so to speak. Would I pay them straight out of pocket? Absolutely, because they're that good. But yeah, I am able to at least get partial money reimbursed to me by submitting them in as an out-of-network person. But I have a continuity of care referral that then reimburses back more to me. And so finding ways to work with the insurance company to get those professionals on staff is key. Initially, when Dominic aged out of infant toddler, that's where we had tried to use a few other OT and speech providers. And within a few months of trying that out, I realized this isn't working. So when you say when I fired somebody, that might be the first time that I fired somebody was when I decided going to Children's Therapy Center was not worth my time, because having seen what Amy and Cindy had done with him, I went back to them and said, hey, can we get back in with you guys in your private practice instead? And then that's when I started working to get them TRICARE certified. And then after they were TRICARE certified, getting the continuity of care referrals put into place. But yeah, that would be, I guess, the only time that thinking back where I would say, yeah, we kind of bench somebody. And it's not because Children's Therapy Center weren't, nice people, but the amount of time I was spending getting there for what I feel like the service I was getting back was nowhere near the same amount as with Cindy and Amy.
Well, and I think to you too, maybe you don't even give yourself enough credit. You really get to know the people working with your child. And so, can you talk a little bit about that? Like, you're building this team and you want to know your team players, like who's going to be working with your child. Now, Dominic's pretty awesome. He sells himself really nicely as well. But what effort did you guys put in, do you feel, to help people really want to invest in your child, especially the therapists that are working with him so many hours? Because let's face it, like, they're overworked, they might be underpaid, they have kids after kids coming in. What do you feel like you did to really help them to buy into Dominic and want to be a part of his team?
Yeah, I mean, I think, just being a nice person, being flexible with timing, being understanding when they're not available. I always give them like a little Christmas gift, every year. I always, have like a little Christmas present for them. And, just I'll spend a few minutes each session just getting to know them, asking how they're doing. Miss Cindy's like family to us now, and so, I'll find out about how her kids are doing, how her parents are doing, just, taking the time to just chat with them, outside of the session for a few minutes just to get to know them as a person. And, sharing each other's struggles, like she'll share things with me. Sometimes I'll share things with her, over time. Especially I feel like having the services come to the house also reinforces that connection a lot more, because you're not, sitting at a center where they're pushing you out for their next client, right? Usually at the end of the session, we chat in our front hall for a couple of minutes before they head out. So, taking the time to get to know them a little bit. And then, like I said, just, I give them thank you cards once in a while. Dominic might make them a little, card himself or some sort of little project, and even just little things. If you ever hear about when their birthday is, a little birthday card always goes a long way, just trying to show them that you appreciate them.
Wonderful. So we're getting a little short on time. So tell me the top three things that you're just amazed about Dominic and what he's doing now.
Where do I begin? I guess
I know, Liz. I want everybody to know something about him.
Academically, right? Everyone always wants to talk about school. I've learned now with the second grader that the county has basically standards of learning that they do even at this level, which I was shocked, but they do. They get them started really early as far as with academia. In liberal arts, in math, science, he is consistently through, I think he's done now 2 rounds, might have even been a third one now that I think about it, of these testings. He's consistently testing in the 95th to 99th percentile. And at first, Lindsay and I thought that this was just like, here at this school, which, maybe has 400 kids in it. But no, it's not only for the school or the state, it's the nation. And he reads, he goes online, and he has found places to go online to read medical literature. And I don't know if he's just kind of seen me with my iPad, but one day he was talking to me about the brachial plexus, that's kind of a nuanced topic early in med school. Another day, he talked to me about the intervention of the diaphragm, what the diaphragm is, how does it work, and why it's central to breathing and respiration and ventilation. And he's describing to me topics that I have interns that would struggle if I put them on the spot and made them talk about it. And so that's pretty amazing to me. He memorizes numbers to a scale, like phone numbers, addresses, sequences for things. He's doing long multiplication and division. The other day, he was talking to me about doing square roots of numbers, prime numbers. I mean, he's going to be much more intelligent than I am. Much
We
more.
had a fraction of his capability, right?
Yep.
Proud of him.
Yeah.
He swims, and he swims faster than the other kids in his little group on Saturday morning, even though he still gets distracted and he's not always focusing on the technique, right? There's friction going through the waters. You got to swim a certain way if you want to be fast. When he does it the way he's supposed to do it, he's very fast. When he wants to daddle around and just look at the water vacuum cleaner, which he's fascinated with, he wants to take it apart, then obviously he's not going to be very fast. He does Taekwondo. He has earned a red belt. So red belt is two and a half, I guess, belts from black. He's 8. He will then have to repeat a little bit because, if he earns it, if you earn that top belt too early, you still have to maintain the form. And if you're not practicing the form consistently, so I've talked to his instructor about what our plan will be like in the teenage years so that he doesn't lose that skill. But that was really important to me because of the discipline aspect. This guy, Master Song is his name. He really, really does a phenomenal job of holding Dominic accountable. And for that hour, if Dominic has to do it 20 times, he makes Dominic do it 20 times until it's right. And the PT component of it, the push-ups, the weight-based calisthenics, none of these guys do any weightlifting. It's all manipulation of your own body weight. And Master Song's probably 70 years old, and he could very easily take down a 20-year-old.
Wow.
Just because of the way his mind is developed and how well he utilizes his body. But it's defensive, right? It's designed to teach Dominic to protect himself, invariably when the day comes that I'm not going to be there because I'm, obviously considerably older than my son.
Yeah.
And so
you're thinking long term, right? Like what it's going to look like. I mean, I have no doubt Dominic's going to be independent someday and he's going to be curing whatever he wants to cure or solve whatever problem he wants to solve. Married with children, driving.
He jokes around, so he's got a sense of humor now. He's a little bit of a wisecracker. The eye contact is probably, it depends on the person, depends on the setting. If he saw Dr. Hensley right now, there would be very, very little difficulty with the eye contact because it's a very familiar face that he loves. But if it was a new stranger, it depends on the person and their personality and how he takes them in. But he is very good at shaking hands and the initial glance at the face. Like he does that really extraordinarily well. And his depth of conversation is above expected for an 8-year-old, at least in my mind.
Yeah, I think the part where, and he's very good about working through this. The hardest part for him now is when he starts stuttering, when he's explaining things, but it doesn't stop him. He pushes through it every time. He doesn't let it stop his flow of conversation. And so, we've been working really, because they do speech with him at school as well. And that's another tip is, make sure your child has an IEP with the school system because the school system has things built into it to help children. He does a social skills group at school. He does his speech at school. They work a lot with him on the stuttering to help him be more fluent in his speech. Because as we know when kids get older, it's going to happen. Somebody's going to make fun of his stuttering at some point, but he doesn't seem to let, it affect him. He pushes through and we want him to continue to feel comfortable pushing through it. The other component too, that we didn't get a chance to talk about is Dr. Hensley also diagnosed Dominic with ADHD. And again, I was reluctant in the beginning for the diagnosis and I really didn't want to start any medicine. But once I did start the medicine, I'm very glad we did because part of the remarkable improvements we've seen is him taking his ADHD medication. And that, you could see the difference. He started it in first grade and the teacher showed us samples of his work before the medication and after the medication. And you could physically see it in the handwriting. His handwriting went from being kind of big and all over the place to formed and defined because he was actually able to focus. And, there's always ups and downs, of course, with starting any medication. We went through some sleep regression, which we still occasionally have some problems with. But it has improved his focus ability so much. We also got with a psychiatric nurse practitioner who added to Dominic's medication a non-stimulant as well. So he does both a stimulant and a non-stimulant, and that complementary medications, we saw big improvements too once he got on the non-stimulant as well. So what I would say is don't be afraid to try the medications if they're recommended, because like any medicine, there will be some ups and downs, but you'll physically see a vast improvement in the ability to attend if they have concurrent ADHD as well, which is, now I understand from Dr. Hensley, extremely common in children with autism to have these other concurrent diagnoses as well.
The singular most impactful decision, I would say, that as parents we made, when you look at sort of the tree and then what happened after that decision was made subsequent, that has been incredibly impactful for Dominic, was making the appointment and meeting with Dr. Hensley. The decisions that were made after that is what, it is a huge reason why I believe that he is as successful as he is. To use a sports analogy, I'm a football guy. That's how I grew up. Dr. Hensley's the quarterback. And if you look at the past 60 Super Bowls, right, it's really hard to win one if you don't have a quarterback, right? It's hard to find those, one or two that were able to pull it off, but it's pretty much impossible.
Thank you. Thank you. You're bringing tears to my eyes. It's so good to see you guys, and you've shared so much today, and it's been such a privilege and a blessing to be a part of yours and Dominic's journey, and the world is his. I mean, there's no reason that anybody should ever place a limitation on your son, and I thank you guys for sharing. You are such amazing advocates, and you pivot so well, and you are such a good team. I know the journeys has not been easy, and it's not over, but there will be no limitations on your son. This autism is his superpower. He is gifted beyond what my brain could ever do. With that, I do want to open up for questions, because I know we probably have some questions from the audience as well. So if anybody wants to turn on their camera and ask Fred and Lindsay or myself a question, we'd love to hear from you. No questions? I'm sure there's some out there. All right. Well, with that, if there's no questions, it is 11:30, and I'm so grateful that you all shared your Saturday with us at Amazing Kids. We believe autism is truly amazing. Our mission is to bring clarity sooner. I hope that today's discussion was meaningful for you. You are not behind. You are not failing your child. As Dominic's parents, Fred and Lindsay, have shown us that Dominic has a superpower. Dominic is so capable, and so is your child. And you have to take those first steps, although they're very hard to take those first steps, to get him the formal evaluation and diagnosis and start building that team. Because even if you do take all those big steps and you get the diagnosis and you don't advocate as Fred and Lindsay have, at some point, Fred and Lindsay, Dominic's going to take over his team. And you are, hopefully you're seeing glimpses of that here and there, because Dominic does have an opinion about a lot of things. And hopefully you're going to find less and less that you have to be the one with the coach's hat. And at some point, he's going to take that coach's hat and put it on all the time. So your dedication and hard work to him is already paying off. He's only 8. And, I know I said this to you guys before. He's 8 years old. He's going to be an adult in 10 years, right? I mean, you're like, probably bring it on, because my son is ready. He's prepared. He's doing great things in this world. He's making friends. He's living his best 8-year-old life, and that will continue. So I thank you so much for your time today. Thank you for joining us, and thank you for allowing me to be a part of Dominic's team. And thank you for supporting us here at Amazing Kids.